I'm a surgeon myself, now retired, but I'm going to tell you the history of the development of surgery. If you look at the word surgery, it's from two Greek words meaning hand and work, meaning situation where you use handicraft to cure disease. Unlike medicine, which of course depends on medical or medicines given by mouth and so on. Medicine itself has a longer history. The ancient medical traditions included those in Babylonia, China, Egypt, India, and soon after that the Greeks and Romans followed. I feel surgeons were at an advantage from the beginning because we were able to see what we were doing. Whereas if there are any physician colleagues say, you make a diagnosis, but without seeing the actual effect of your medication on the tissues, you have to carry on your treatment. On the other hand, surgeons can actually see what's happening. I mean, if you have a lump somewhere, you remove it, and you see you have virtually cured the patient. But still, the spectrum of surgery wasn't as vast as it is today. It was very limited. It was limited to treating surface wounds, suturing wounds, dealing with abscesses, perhaps a few fractures or dislocations. So they were rather limited. There's archaeological evidence from many centuries ago for the practice of suturing wounds, amputating non-viable limbs, and dealing with ulcers. And if you look at the historical development, people have discovered pointed pieces of stone with sharp edges, which would have served as knives during the Stone Age. Now, like every aspect of human civilization, these things started in Mesopotamia. Archaeologists have discovered tools with sharp edges, resembling today's knives that we use. Babylonians have had a code of conduct to see the actions of medical personnel. They had some control over what the medics were doing. If a physician made a cut with an operating knife and cured the patient, he would receive so many shekels of gold. But on the other hand, if the patient died from the surgery, the poor surgeon's hands would be cut off. Rather drastic treatment, I would think, but there you are. Now, soon after that was the era of Egypt. The first pharaoh of Egypt, Nama, had his capital in Memphis. Even in that era, 2700 before Christ, he actually, they wrote a treatise on surgery. It was written by Imhotep, who was a priest, astronomer, and so many other things. And he was so famous that they deified him as the Egyptian god of medicine. On a door jamb or door frame at the entrance to the temple in Memphis, there's the oldest recorded engraving of a surgical procedure, which is actually, anyway, any guesses, anybody? It was a circumcision. It's actually where you remove the redundant foreskin from the male organ. Still practiced quite extensively in the Middle Eastern countries. Now, I'm sure you are familiar with the papyrus plant. It's known as the Nile grass because it uh, grows south of the Nile or in the Nile Delta, and the Egyptians used it, the dried papyrus was used for writing purposes in the pre-paper era. This is the papyrus plant. One of the first papyruses that are preserved, not very well known, but from about 1600 BC, the Edwin Smith papyrus is a manual for performing surgery for trauma, for injuries. It gives so many case history. I'm not going to go through the list of injuries, but there you are. I mean, they were wise enough to teach the people what to do. Now, this is the Edwin Smith papyrus. I won't try to read it if I were you, because it's actually in Arabic. Now, while this was happening in that part of the Middle East, some Asian tribes used mixtures of saltpeter and sulfur. I'm sure saltpeter is quite familiar to the chemists among you. The Dakota people used the quill of a bird feather to suck out purulent material or pus from a abscess. The Maasai people of Africa used thorns of acacia for the same purpose. Tribes in India and South America developed an ingenious method of sealing minor injuries by applying termites into wounds to get them to eat into the wound, and then they would break off the body of the termite and end up with a wound as if it was sutured with sutures. What you see there are not actually sutures, but the appendages of the termites. The text is given there. This is practiced in East Africa even today. One of the oldest operations they had practiced was trephination or trepanation, which is simply creating a burr hole. Now, even today, if there's a head injury or collection of blood inside the skull, what surgeons do is to drill into the skull and remove the blood. Now, this kind of thing has happened even in that era. Like you see here, the artist impression of what burr hole surgery is like. There's evidence for this, not from just that area, but even previous to that, from Neolithic times, there are cave paintings that show this procedure recorded. This is what a skull of a person who has had burr hole surgery would look like. You can see the holes on the top of the skull there. Now, there was a chap called Hua Tuo, a very famous Chinese medic. He lived during the Chinese Han era, and he is claimed to have been the first to perform surgery using anesthesia. I'll talk about anesthesia a little later, but just remember, even 140 to 208 AD in China, they had practiced surgery using anesthesia. This is Hua Tuo, artist's impression. Obviously Chinese, he's at the mahjong table and well-fed sort of gentleman, and this is what they practiced in those ancient centuries. Treatment of fractures, broken bones has happened from real ancient times. You can see healed fractures in prehistoric skeletons even, and even the Aztecs of Mexico described a method of treating broken bones, which is akin to what we do today, known as cane nailing. I'm sorry, there's no pointer there, no? Sorry. Now, everybody's heard about Hippocrates, the father of modern medicine. He actually lived in the 5th century BC. His Hippocratic oath, even today, lots of medics take that oath, and it describes surgical maneuvers in detail, in some detail, and if you look at the last 2 lines there, the Hippocratic writing is on dealing with fractures, on disease of the joints, and even hemorrhoids. Aelius Galenus was a physician and surgeon in the Roman Empire. He wrote a lot about surgery. His books, Galen's books 1, 2, and 3, it's an excellent account of an accomplished Greek surgeon and physician in the 2nd century in the Roman era. Now, near home in India, there's a lot of evidence of surgery happening there. You must have heard about Sushruta, the famous father of surgery in India. He apparently was one of the 10 sages residing in the Himalayas, and he is said to have learned his surgery from Lord Dhanvantari, one of the considered the god of medicine in Hindi mythology. Sushruta wrote a lot of books on surgery. Sushruta Samhita, it's a main source of knowledge about surgery in ancient India. And if you read the lines below, you find diverse things talked about removal of a dead fetus, about lithotomy, that's removing stones from the kidneys. So Sushruta certainly practiced surgery properly. This is an artist's impression of Sushruta. He is the guy there seated. The disciples and perhaps the nurses are surrounding him. Now, we had our own King Buddhadasa in the 4th century AD. He claimed to have been a very caring and pious surgeon, and there's a surgery about him removing a tumor from the belly of a cobra. I don't know how authentic that story is, but it is there in the Mahavamsa. There's a place called Alahana Pirivena. Some of you might have heard about it. It's in Polonnaru area. Excavations done there in the 1980s revealed evidence of a building complex which is likely to have been a monastic complex known as Alahana Pirivena. And there were found some instruments that look like surgical instruments in use today. It looks crude, but I'm sure it has served its purpose. Now we move to the medieval age, the 5th to the 15th century. The surgical practices learned from the previous masters were improved and refined during this era. And you've heard about Renaissance in the 14th and 16th centuries. Lots of other helpful devices were invented, like the microscope, the germ theory of disease, and military doctors advanced methods of trauma management. The famous people during that time were people like Abul Qaziz, Avenzoa, Spanish Muslim physician, and Rogerius Selenictus. He again published some manuals on surgery. Now, medical education started just before that, in the 9th century, the first medical school was founded in southwest Italy, and the teaching was actually in Arabic. There is an artist's impression of that first medical school in Salerno in southwest Italy. There were European surgeons who practiced during and soon after that era. There were Wijesuriya, who wrote the Chirurgia Magna, or Great Surgery. It was a standard text for surgical training even until the 17th century. Now, I'm sure everybody's heard about barber surgeons. In England, we surgeons are not considered medical people, but barbers. It's actually barbers who started treating surgical problems. There was a recognized worshipful company of barbers formed in London in 1308. Now, they were not given any formal training, but they served, it was a yeoman service, and but they had a poorer reputation than the physician counterparts. Now, that brings us to the era of the Industrial Revolution, which I'm sure everybody's heard about. That was in the 18th and early 19th centuries. Lots of things changed for the better, and new innovations replaced human labor, and these invariably had a huge impact on the practice of medicine as well as surgery, even more so surgery. Three of the things that were thrown on the surgeon side were the three problems of bleeding, pain, and infection. Now, during the Industrial Revolution, people were trying to overcome these problems, and they did. And that transformed surgery from the risky art that it was into a more scientific discipline, so that surgeons could proceed with more safety and indeed success. By the mid-19th century, medicine had made rapid progress. Surgery didn't make that much progress then, because it had to wait until another thing happened, the advent of anesthesia, being able to put the patient to sleep for surgery. It was not until the later decades of the 19th century that the surgeon truly became a recognized clinical practitioner. By this time, the surgeons were more confident in dealing with major vessels in trauma and some other more sophisticated operations, if you like. But sadly, a lot of inexperienced or inept attempts are made, and surgery ran into some disrepute. One of the main problems surgeons had was that they couldn't deal with compound fractures adequately, fractures where there's an open wound on the surface. In spite of these problems, surgery still advanced, and the next major breakthrough came when anesthesia was introduced. The ability to put the patient to sleep for surgery. Because until then, surgery was necessarily a painful procedure, and this is how an artist represented the surgical operation in the pre-anesthetic era. You can see the guy howling in pain. Names come into the picture. I'm not going to go through all of them. This is Vesalius, who is, as you can see, he is holding a dissected arm, so he was practicing more scientific surgery. Ambrose Paré, he was a French army surgeon who used cautery for controlling bleeding. These are some other famous 18th and 19th century surgeons. You might have heard some of the names: Percival Pott, who described spinal TB; Ashley Cooper performed the first successful ligation of the aorta in the abdomen, and James Syme pioneered Syme's amputation of the ankle joint. Now, this takes us into the age of enlightenment in Europe, and the most famous surgeon during that era was John Hunter, a Scottish surgeon but practicing in London, and that's his statue in College of Surgeons of England. He actually reconstructed the surgical knowledge from scratch, refused to just depend on others' evidence, but tried to confirm things himself. And he built up a museum of 13,000 specimens, huge number at that time, and it's preserved to date at the Royal College of Surgeons in London. He introduced a few specially popularized operations, but read the last line. He held the view that all surgical procedures should only be used as a last resort. He was by no means a cowboy surgeon. Very quickly about antiseptic surgery. One of the problems initial surgeons had was that wounds got infected. Now, this chap, Ignaz Semmelweis, he was actually a Hungarian obstetrician. He recognized the importance of these germs, and soon afterwards Joseph Lister did a lot of work on infection, and he advocated the use of carbolic acid or phenol for sterilizing instruments as well as sterilizing the patient's skin. You see, even at the time of Joseph Lister, there were no facilities for even washing of hands in the operating theatres. So he advocated the use, and he is often considered to be the father of modern antiseptic surgery. If you read this through, he was principally involved in advocating aseptic surgery. So we have had several fathers of modern surgery. Hunter was for a time known as the father of surgery. Lister was labeled father as well. Whoever was the father, we move into the 19th century, by which time surgery was performed in the operating theatres, not in the open air like you've seen in the previous slides. And one other important person who introduced principles of surgery was Halsted. He worked in Johns Hopkins in Baltimore, on the other side of the Atlantic, and he believed in improving the cleanliness of surgical operations. He came out with these principles which we learned as trainees, and it purely illustrates that he had the insight as to why surgery was often going wrong. Very quickly, the next two things were the X-ray or imaging, radiological imaging, which was introduced by a German physicist, Wilhelm Röntgen, but soon there were other more sophisticated types of imaging. And today there are more techniques and technologies that have arrived in the surgical scene. There's electrosurgery and endosurgery, where we can put instruments through the mouth and do surgery inside the gut. That's GI endoscopy. Laparoscopic surgery in the 1970s and 80s, where you can put in through skin openings instruments and do surgery without having a big cut. Right. So that in a nutshell is the story of surgery. I hope I haven't been too rushed, but there you are. Thank you very much.